Are you having shoulder pain when you do overhead reaching activities, when you play sports, and when you lift weights in the front of your shoulder? Welcome back to my channel, Annie Pilates Physical Therapist. I will discuss the importance of our posture that helps open it up on our shoulder to prevent impingement syndrome of our shoulders, utilizing Pilates, yoga, and physical therapy based treatment plan to strengthen the muscles surrounding our shoulders, the rotator cuff muscles, and our upper back postural muscles to keep it strong and healthy. So get your mat and an elastic band to join me. Let's discuss first the anatomy of our shoulder muscles, the rotator cuff muscles. So there's 4 of them, all wrap around the side of your shoulder to insert to your greater tubercle of your humeral bone, and then there's also the lesser tubercle. They're side by side, and they were anchored on our acromioclavicular joint, which is part of our clavicle and acromion at the base of the scapula that holds our shoulder. Our shoulder is the most shallow joint, which means it needs a lot of support on our shoulder so it won't get dislocated. As well as with bad posture, it causes impingement more because it's like a pulley system that gets tight. When you open a door, it gets jammed. And when you have more jamming on the tendons, the 4 rotator cuff muscles that bundle together, it causes frays and tears and inflammation. We call it tendonitis. And if you don't fix it right now, it could cause tears and surgeries. So I'll show you some simple stretching and strengthening to strengthen these muscles. So the muscles that we're going to target are the supraspinatus. Supra means it starts on the supraspinatus fossa of our shoulder blade, and it wraps around to your greater tubercle of your humerus. So the supraspinatus helps with abduction that initiates the first 5 degrees. The second one is the infraspinatus. It's below the supraspinatus. That's in the infraspinatus fossa. That also wraps around together. And the infraspinatus external rotates as well with the supraspinatus, so they're together. Back of your shoulder blade that you see in the blades, there's a division, and there's superficial muscles. And these muscles help keeping the glenohumeral joint, the head of your humeral bone, stable when you do activity. And then the subscapularis, which is underneath your armpit, which starts on the subscapularis fossa, inserts to the lesser tubercle of your humeral bone, and this one is the only one that internal rotates. So the supra, infra, and teres minor external rotates, and then the teres minor, which starts on the lateral border of your scapula that wraps around as well like diagonally, helps more on adduction of your shoulder to keep it centered so it won't get dislocated. So these are the 4 muscles, specific function on each one, and they all bundle together and causes sharp pain over here. Usually the supraspinatus and infraspinatus, the first 2 one on the top part, are the most common to be torn because it's closest to the hinge of the pulley system. And then we have the posture that I was telling about earlier. So if you had bad posture such as forward head posture, you look at my movement, bad posture is more limited for overhead reaching activities. Impingement on the pulley system is like a door that's getting jammed in the front and causes tendonitis and inflammation. It's the 180-degree flexion of your shoulder. There's a 2-in-1 ratio. So once you pass 90 degrees, it's all shoulder, the glenohumeral joint. But once you go further up, on the 90, there's a ratio that starts your scapular muscle. Scapular, called the scapulohumeral rhythm, that slowly rotates upward to help reach the end range of shoulder flexion. It's like 120 degrees and 60 degrees on your scapular rhythm. And if you have tightness on your rhomboids, upper traps, deltoids, then it causes more jamming on your glenohumeral joint because you're forcing the flexion, and that causes pain, inflammation, tears, and injury if you don't release the spasm here and strengthen your posture. How do you evaluate if you have impingement syndrome? So there's 3 special tests we can do today. The first test is the Hawkins-Kennedy test. So you elbow and shoulder bend to 90 degrees. Slowly twist inward and put pressure more, and then if there's sharp pain, then it's positive. The second one is the Near's test. Elbow straight to 90, thumbs down, and put a resistance at the back of your arm, forearm area, and then if there's sharp pain, it's also positive. And the third test is the empty can test, which is also for rotator cuff injury. So 45 degrees like a letter V, thumbs down, rotate to inward, and if you resist and you drop because of pain, there's a possible tear. So my recommendation is to see a doctor and a physical therapist near you to make sure it's not a full tear or partial tear. Sometimes with partial tear you can still fix it if it's not a lot of wear and tear, because you can build up the scar tissue and strengthen the muscles to support it, and hopefully you can prevent surgery. However, sometimes surgery is the only option. But these exercises I will show you is for impingement syndrome that's still not torn. So the first exercise is, let's warm up first. Sitting up straight, let's engage our core muscles and take a deep breath through your nose. Belly button in and shoulder backwards, and hold it there for 5, 4, 3, 2, 1. So I'm pulling my shoulder back to stretch the tightness in the front, and then slowly lean back more and slowly look up. You'll realize your neck muscles are tight because, as I said earlier, with forward head posture, it causes more impingement on your shoulder. So sitting up straight, belly button in and open. Take a deep breath through your nose and blow. It's nice to warm up your shoulder first so you don't hurt it when we do some elastic band and strength training program utilizing our body weight. Take a deep breath, belly button in, and my recommendation, opening up your shoulders starting from shoulder backward roll, 5 seconds hold up to 10 times, then you can slowly build up to 10 seconds hold. Now with an elastic band, wrap it on your hands, both elbows on your waist, keeping your shoulders back, and stretch, and slowly separate your hands apart and back. My recommendation is do this at least 10 times and slowly progress to 3 sets of 10. There's different levels of resistance, and this is a blue band, so this is a little bit more difficult. You can always start with the lighter resistance. So when you go out, try your best to reach external rotation up to 90 degrees. However, if even the elastic band hurts you, then let go of the elastic band, elbows on your waist, and just gently open and hold it there for 5, 4, 3, 2, 1 with your breaths and blow. Take a deep breath through your nose, belly button in and open, and hold it for 5, 4, 3, 2, 1. And to progress with that, you can get towel, roll it, and just do isometrics and hold it there, elbows bent to 90, and hold it for 5, 4, 3, 2, 1. Even though we're not moving, it still strengthens the muscles, the external rotators. And then you can use dumbbells or can of soup. Lie on your side. Twist your right side, elbow to your waist, touch your belly button. Take a deep breath and slowly open. Inhale through your nose and hold that for 5, 4, 3, 2, 1. So you're utilizing gravity. My recommendation, if you're going to use the can of soup or dumbbell, is to do side lying. Don't do it in sitting up because you're not against gravity and you might hurt your shoulder, and you're just targeting your biceps. Take a deep breath, last one. This is demonstration only, and I could do a follow along on my next video, and blow. And after doing the external rotators, we can do the internal rotators now with the elastic band. Place it on the arch of your foot. If you're going to target your right side, belly button in, and come closer first to start first. Keeping your elbows 90 degrees, elbow on your waist and pulling towards your belly button. Take a deep breath and hold that for 5, 4, 3, 2, 1. So you can feel it for your subscapularis deep inside your shoulder. Take a deep breath and hold it for 5, 4, 3, 2, 1. Again, you can progress and extend more your foot out and then do it as well. This is the blue band, so it gets much more difficult. You can also make it one-sided only by wrapping and tying it on your foot. So it's only one elastic band, not double it up. And that's bent to 90 degrees with your shoulder perpendicular, and slowly pull it towards your stomach and hold that for 5, 4, 3, 2, 1. And my recommendation, pull back for eccentric control for your subscapularis. 5 seconds hold and slowly progress for 10 seconds. And slowly go back. Eccentric control for the subscapularis, 5 seconds holds up to 10 reps, and the next one will be our hands and knees. We'll be on our hands and knees, close kinematic chain utilizing Pilates and yoga. You slowly go down, looking down to your belly button with your breaths, pulling your belly button in. With your breaths, take a deep breath and hold that for 5, 4, 3, 2, 1. Arching your shoulder like an angry cat. Pulling your chin tuck in more, and then slowly look up while slowly sticking your butt cheeks out, making a beautiful arch of your low back area, and look up as high as you can for the downward rotation of your scapula. Take a deep breath through your nose and hold that for 5, 4, 3, 2, 1, and let's do this one more time. Take a deep breath. Angry cat, take a deep breath. 5, 4, 3, 2, 1. And slowly go up to camel. Take a deep breath and hold it for 5, 4, 3, 2, 1. And blow. Recommendation, 5 seconds hold in both ways, 10 repetitions. Then slowly progress to shoulder flexion, slowly reaching forward and hold it for 5 seconds hold. 2, 1, and do it alternating. So you weight bear on your scapula, keeping your shoulder square and holding that for 5 seconds hold. Up to 10 repetitions, alternating. And I will do a follow along video. This is demonstration only for the next one. Belly button in, last set. For now, do this every single day, so when we do the follow along video with the progression with the elastic band, you're ready. After doing that, then the next one is shoulder push-up, keeping your elbow straight, then slowly lower yourself without bending your elbow. And when you go up, hold that for 5 seconds, hold 5, 4, 3, 2, 1 with your breaths. Take a deep breath and then slowly go down and hold it for 5, 4, 3, 2, 1. The next one is shoulder abduction. Slowly lift your arm to the side and hold it for 5 seconds, hold 2, 1. And if you're targeting your right side, you keep doing it. And after 10 repetitions, my recommendation is to do the opposite side as well, so you balance your shoulders. It's good to keep your shoulders strong and healthy at the same time, bilaterally. And after doing that, you can end your program with a beautiful stretch, child pose. Slowly look down, touching your head, sitting on your tush, and hold it for 30 seconds. Hold. Take a deep breath through your nose. Belly button in and feel the lovely stretch on your shoulders and lengthened. Take a deep breath. Last one, and gently blow. And that's it. Hoping you're feeling better on your shoulders. Please check out the forward head and rounded shoulders posture that I have down the link. Make sure to open up your shoulders more and your chest area, strength of your upper back and neck. That will help your shoulder impingement. As my recommendation is to put some heating pads or hot compress on your shoulders before starting treatment. If you're having this more than a month already, we call it chronic inflammation. But if it's just new and you just had a recent injury from sports, then put some ice first. Please like and subscribe my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays, Fridays, and Sundays, or sometimes Mondays for Pilates, yoga, physical therapy, health, and wellness. wellness. You can also follow me on my social media, my Facebook, Instagram, Reddit, and I have a Patreon account that you can check out the link down below to support my channel more so I can make better videos just like this one. And I have more social media down the link below so you can follow me and see what's going on in life as I share more about health, wellness, Pilates, yoga, and physical therapy. You can also leave the comment down below for special requests that you might have for any part of your body that needed help with. Thanks again for watching. Have a great and stronger you. Bye!